I should have started by introducing myself. My name is Louise Unsworth and I'm an Assistant Director at the North East Public Health Observatory. Welcome everybody. I'm going to do a sort of quick introduction, giving an update on the new tools, data, profiles that I know about, and just a quick forewarning of a few things that might be coming out soon that you might be interested in. Some of you might already have spotted this, but I think it's quite an interesting data set. The NHS Information Centre now publishes monthly data at general practice level for individual prescription items. So here's an example of something that I downloaded yesterday. It's for one general practice, it's for things that they mainly prescribe. It's for practice A86003. And I think the potential for this is that it could be used as part of needs assessment work. I know that there is pharmaceutical needs assessment work that goes on, but some of the things that are in here, prescriptions related to diabetes, to heart problems, are things that I think can help illuminate some of the other data that we use at the moment. So, just to go through it, that's simvastatin is a particular type of drug that's used, the statin. That particular practice prescribed 1,333 items with a net ingredient cost of £2,200 approximately, just for April. So it sort of helps to give an idea of the scale of some of the prescribing and the amount of money that's involved in it. Changes to mortality data. I think this is quite important, and I just happened across it. From January 2011, there's been a slight change in the coding that's used to allocate the underlying cause of death for people when they die. So it's been updated, and from January 2011 it started to be used in deaths data. So a lot of the aggregated data that we look at is annual data. And we'll probably get the 2011 annual data coming out fairly soon. So it's just to flag up that there are some things that have changed and that might have implications when we're looking at time trend data. So one of the key ones is when they retrospectively looked at a set of data, coded it using the old rules and coded it using the new rules. There's a 32% difference in deaths that have an underlying cause of death of mental and behavioural disorders. And the reason for that is a slight change in coding for deaths from dementia. So if you imagine that we're looking at time trend of data, we'll expect that we'll suddenly see a big increase in that. The other significant ones are an increase in deaths from circulatory causes. And that's caused by changes in selection rules to cardiomyopathy, heart failure and cerebrovascular disease. 5% is actually quite significant because we've had decreasing numbers of deaths, premature deaths from heart disease for quite a long time. So it will be interesting to see whether our trends continue to go down or there's an apparent change. But that change might not be an actual change in the underlying causes. It might be down to the coding system. There are a few other things that are affected. Deaths from diseases of the genitourinary system have decreased, and that's because deaths that were previously recorded as having urinary tract infection and dementia have now been assigned to dementia, which seems very sensible. And respiratory deaths have shown a 2% increase, and that's to do with coding of deaths with an underlying cause of pneumonia. So it's just something to be aware of when you're looking at time trends. There doesn't seem to be, for the analysts out there, doesn't seem to be a bridge coding, which would mean that we could retrospectively look at time trends with the new coding and see what the trends were. So we might see some blips on the trends that we're looking at for deaths. Local health profiles, I'm sure loads of people will have seen them before. The latest ones came out at the end of June. There are profiles for each local authority, and we've got a selection of the North East ones on the table there. So This is just to flag up that they're out, they're available, they're easily downloadable. Just to remind people who maybe just see one format or the other, I think the paper copies are pretty common, but there's also web-based access to the data as well. It's highlighting two of the indicators. The top map shows breastfeeding initiation, the bottom one shows smoking and pregnancy, and it just allows you to neatly look at the correlation between any of the indicators that you choose to look at. So there's a fairly high correlation between those. It also allows you to highlight on the map, for example, we've got Northumberland highlighted there, and somewhere in the graph, although I can't see it clearly, yes, there it is. You can see where Northumberland lies on that graph compared with all the other local authorities in England. There have been a couple of changes in health profiles this year. On page 2, they used to look at quintiles of deprivation and life expectancy for each quintile, and now they're looking at the slope index of inequality, which is just a slightly more accurate way of doing things. There's a new chart on page 3 which looks at hospital admissions that were emergencies by ethnic group, and that replaces educational attainment by ethnic group. And on page 4 there's the big spine chart that shows all of the indicators and where your local authority sits in that. There are a couple of changes in the indicators, but there's also an attempt to highlight indicators that are going to be part of the public health outcomes framework, which I think is going to be really important when this comes out. Teenage pregnancy, the East Midlands Public Health Observatory leads on that topic, and just highlights that 2010 data is now in there. 2010 data for local authorities, that is. There is ward level data, but it's not as up to date as that. Makes it fairly easily accessible. There are loads of tools and loads of profiles, as I mention every time. On the AFO webpage, apho.org.uk, there's a directory telling you all the tools that are available, where you access them, and description of what's in them and what geographies are covered. National Obesity Observatory has done some quite interesting work looking at fast food outlets. So they've mapped the number of fast food outlets per head of population by local authority. And this shows lots of dark areas for the North East, indicating quite a lot of fast food outlets. We've also done a bit of correlation showing the number of fast food outlets in a local authority, comparing that with deprivation levels, and you can see that there's a fairly clear correlation between them. General practice profiles. Some new indicators have been added to these. For people who haven't seen them before, it's a web page where you can go, you can select your local authority, you can select your region, you can select your PCT or CCG, and then you can pick any practice that you want to look at, and it gives you a whole range of indicators for each of those practices. It also does allow you to look at the CCG as a whole, though. And I think it's one of the few tools at the moment that does provide that aggregated data for that geographic range. So the indicators that have been added are indicators for needs assessment. They're not necessarily new indicators because they've been included in the AFO Joint Strategic Needs Assessment dataset, which provides a load of indicators at medium super output level area. It's fairly small geography. This basically takes the data for those indicators and groups them together for the MSOAs in any particular practice or CCG. So it's just an aggregation, but it's quite an easy way of getting your hands on that data, and if anybody's involved in doing needs assessment work for practices or CCGs, then I think this is probably quite a useful tool. Publications. We've had a bit of a raft of publications coming out recently. One of them came from the Neurological Network. In the past, NIFO had produced a report on neurological conditions and hospital admissions for people with neurological conditions. And this paper is basically an update of that. So the highlights are that there were nearly 15,000 admissions to hospital in the North East for people with neurological conditions, and 53,000 finished consultant episodes that have a long-term condition either as the main cause or as a comorbidity. So it's quite a substantial issue. And it also looked at evidence of inequalities in service provision, issues of levels of deprivation in where people were admitted from, and what impacts that had. Just out this week is a paper on premature mortality from alcohol. We produced a paper last year about premature mortality from tobacco, and this is supposed to be a sort of companion piece to that paper. And it just looks at what the size of the issue, what people are dying from, what the key causes are, and how that varies across the region. The Health Needs Assessment for Children and Young People is hopefully going to be published this week. This is a needs assessment, not just a cancer needs assessment, but a needs assessment for children and young people with cancer. So looking at their broader health issues. And also looking at the effect that cancer at a young age can have longer term on people. And that work was done in collaboration with the Cancer Network. I'm just going to flag up the Learning Disabilities Observatory reports, and I'm sure Giles can talk to them if anybody's interested, but there has been quite a lot in the last quarter. I guess, I don't know, the key one might be for people here, people with learning disabilities in England, which is the kind of annual overview. Is that fair?
I'd say the other key one is the uptake of health checks. The big issue in doing something about the health of people with learning disabilities is getting annual health checks. And these are GP health checks. And basically people with learning disabilities don't go to their doctor because they don't recognise what symptoms mean or that they should. And annual health checks turn up all sorts of very treatable, very important sorts of condition which make a lot of difference to people's health and well-being. And they've been funded now for 4 years, and the uptake of them is not brilliant, and it's particularly, I'm afraid, not brilliant in the North East. If you look on our website for health checks, you'll find all the details.
Thank you. And then I just wanted to flag up a few things that are coming out soon. The alcohol profiles, I guess a lot of people will have seen the profiles that are available, giving an overview of risks, treatment, mortality related to alcohol. They're produced every year at local authority and PCT level, and the next versions are coming out on the 16th of August, which is tomorrow, isn't it? And whilst I mentioned alcohol, also on the same website, which is lap.org.uk, there's a consultation going on at the moment about methods for estimating admissions to hospital that are related to alcohol. Looking at the methodology, so if anybody's interested in that and might want to take part in the consultation, there are response forms available on that website for people to download, but they do need to be in by next week, 23rd, so I think tomorrow. Sectional health balance scorecards are produced by the South West Public Health Observatory, and they are due to be published on the 23rd of August as well. West Midlands produce some profiles for on people and their updating indicators, which should be out this month. In observatories, we've done quite a bit of work for the Chief Medical Officer's annual report, which has huge amounts of data and graphs and maps in it. That's due out sometime in September. And then I think the other key one is the Public Health Outcomes Framework. There's a lot of work going on in terms of populating the indicators that are fairly easy to populate, developing indicators that are maybe not in use at the moment but are in areas of interest, and certainly some of those that are in mental health. But the first lot of data is expected to be published in October, we understand. So we'll let you know about that at the next PHINE meeting. Just a couple of other things. The census information I mentioned at the last PHINE network meeting the information by local authorities in 5-year age bands by gender is now out. In NIFO we've put together some population pyramids, just looking at what the population for each local authority is at the moment and seeing how that compares with what the population was in 2001 and what the most recent estimates were for 2010. So for example, we know in Darlington, when the population estimates from the census came out, there were about 5,000 people more in the population than they were expecting there to be. So it's just a kind of quick overview of, you know, what does that mean, which age groups were different. The draft at the moment, and we'd really appreciate your comments on if you think that's useful. So if you just want to scribble on, you know, if you've got any suggestions, have a look at them over coffee. PHINE local authority groups.
Yeah, so we've been working with our local authority partners and trying to find ways to collect information together for them, and what we've come up with is a series of groups for each local authority. You can find these linked from the homepage. It says on there, I work in local authorities or something. And so for each local authority there is a group, and within that group there are resources. And at the moment people within NIFO have been loading things like the relevant health profiles, kind of other data specifically relevant to those groups. But on top of that, our colleagues in FUSE, I can't see where Mark is, have also been loading relevant FUSE research as well. Later this month, the Institute for Local Governance will also be joining our platform, and so their resources too will be going in these groups. So hopefully what we'll have is a really useful resource for people in individual local authorities which have just all the information they'll ever need. But obviously we're always keen to have feedback, so if you look in those, at the moment they are kind of still developing, but if there's anything you feel is important to be in there that's missing, just do get in touch and let us know and we'll add things in.
We're trying to make things easier because we recognise that, you know, all people's profiles might be on the West Midlands Public Health Observatory website and alcohol profiles might be on the North West one. So by trying to put all your local authorities' relevant resources in one place, hopefully it will make things easier for you to access. But equally, if you want to start adding things to your own local authority area that you think other people might be interested in from Darlington or Hartlepool or wherever, you know, we would welcome that. Final couple of things. In the Public Health Observatory, we are anticipating advertising for an analyst, probably a Band 7, Durham Band 7 analyst. So if anybody knows anybody who's interested in quite a short-term job, it's only until the end of March in the first instance, but do let us know and we'll probably advertise it on the PHINE website so that people can see it. And the only other thing I think is that the next PHINE network meeting is on Wednesday the 14th of November.